At the Glasgow HIV Congress this year, investigators from Makerere University in Uganda, University of Nebraska, as well as University of Liverpool presented data on a drug interaction study that had been conducted among Ugandan women. So the presentation was about implant contraceptives and the commonly used antiretroviral drugs in sub-Saharan Africa. Yes. So the issue here is that women the WHO, the World Health Organization, recommends that women use a drug known as efavirenz as part of their initial treatment for HIV. A few other women use nevirapine based on previous recommendations, but most women are currently using efavirenz as part of their HIV treatment. These drugs are very effective against HIV. They work. But we did not know whether or not these drugs could be used with a type of contraception that women would need. Now, in Africa, most women with HIV are of childbearing age, and then they may want to use a type of contraception to prevent further pregnancies. But how do we use contraceptives along with HIV treatment? So what we looked at specifically was an implant contraceptive. The implant goes into the arm. It's called a levonorgestrel implant, and it's two little rods that are put under the skin. And women like that because it's confidential, it's private, it's something they can control, and it's also long-term. It's supposed to last for up to 5 years. What we did was to look at how much of the implant would be present in the woman's blood over time if they were using efavirenz-based HIV treatment, nevirapine-based treatment, or if those women were not yet started on antiretroviral drugs. What we found was that nevirapine levels were okay. In fact, they were even somewhat higher than amongst women who hadn't started antiretroviral drugs. But efavirenz levels were about 60% lower at 6 months of therapy. So at 6 months of therapy, we already had doubts whether these implants would work. And you know, this is a cause for concern because if at 6 months, women already have low concentrations of the levonorgestrel from the levonorgestrel implant, it's highly unlikely that that kind of drug would still be useful for them up to 5 years. So we feel that this is very important work because it helps us to understand what the best contraceptives would be for these women. But it also raises the concerns that, you know, we need to know more about how these implants work and how best to use them in this population.